Hi everyone, my name is Anne and today I'm going to be talking about mumps. So just a short overview of mumps. Mumps is an acute viral illness that causes the swelling of the parotid gland as seen here compared to this healthy child, and it's caused by the paramyxovirus. So first, the nomenclature and taxonomy of mumps. Its formal name is parotitis. Its common name is mumps, as we call here, mumps virus and MUV for short. And the proper nomenclature is mumps rubella virus. Its taxonomy is right here. And important to note is that its family is Paramyxoviridae, which not only causes mumps but also other diseases such as measles, the canine distemper virus, the parainfluenza virus, the Newcastle disease virus, and the metapneumovirus. So what is the infectious agent that causes mumps? First is the Paramyxoviridae. It's called the Paramyxoviridae, and it's characterized as enveloped, non-segmented, negative sense RNA, which is the negative ssRNA, and it has spikes on the surface, which are glycoproteins, viral attachment protein, and the fusion protein, and its size is from about 100 to 600 nanometers. So if you look here on the left in image A, this is the electron micrograph of the Paramyxoviridae, and on the right side is a schematic drawing of the particle. Here is the HN and the F glycoprotein, and it also has viral attachment proteins and the fusion protein. So what is the pathology and pathogenesis of the mumps virus? How does it invade the body? Actually, right now, knowledge of the pathogenesis of mumps is limited because most of its studies are actually done on animals. I believe on rodents is the main, guinea pig for pathogenesis, and then this is the knowledge of it is limited because it's rarely fatal in humans, and so we don't have the autopsy results that allow, further discovery or further understanding of how pathogenesis of mumps occurs in humans. So it's still a gray area right there, but what we do know is that the virus is released from the basal side of the epithelial cell and then into the lumen. Then it attaches onto the sialic acid, which is in the polarized epithelial cells in the upper respiratory tract. And then it targets T cells. And so the mumps virus infected cells are able to escape the host immunity by degrading STAT1 and STAT3 by the mumps virus 5 protein. So in this way, the IFN and the IL-6 signaling is inhibited, and so then the virus is able to evade both the innate and the adaptive immune system. So with all of this, what actually happens is that, again, the IFN pathway is blocked, and so viral replication is enhanced in the glandular epithelium. And last but not least, we get viremia, which is the virus is present in the bloodstream. And because of this, the bloodstream can carry those viruses to other tissues, other glands, and other parts of the body, such as the parotid gland, which is the hallmark of mumps or the primary site of infection. And viremia can carry these viruses to your kidneys, to your testes, and then the virus is ultimately excreted via the saliva and the urine. And it can also affect your central nervous system as well. So how is mumps transmitted from person to person? How does it enter the body? And what is its immune response? Mumps is an airborne disease, and it is also spread by direct contact. It's spread mainly by the respiratory route, so by coughing, sneezing, inhaling, or talking to someone, you can spread this disease. And also through direct contact, so like drinking after someone, eating after someone, you can also get mumps that way. The only reservoir of mumps is in humans, so not in animals, and the at-risk population here is unvaccinated children between the ages of 2 and 12, which are most commonly infected. But also it can affect other age groups such as older people, and this would actually affect more of their central nervous system, and their pancreas, their prostate, the breast, and other organs may be involved as well. Generally, mumps affects children in developed countries because they don't have the immunity that children in underdeveloped countries would actually have. Usually, though, this disease is mild. And so, now talking about its incubation period, viremia in the early acute phase occurs after 12 to 15 days, so it lasts about 2 to 4 weeks in your bloodstream, and the virus spreads to tissues and glands from there. Then, after 3 to 5 days, parotitis occurs within the first 2 days. And then what parotitis is that it's the swelling of your parotid glands, so the gland between your ear and your jaw. And symptoms decrease after 1 week, and it resolves itself after 10 days usually. So how can mumps be prevented? The most common preventive measure that you can take to prevent mumps is by getting the MMR vaccine. And it's called this because it treats all 3 measles, mumps, and rubella, or it prevents these 3 diseases, and it's given in 2 doses. The first dose is when you're between 12 to 15 months, and the second from when you're between 4 to 6 years old. This vaccine is an injection that contains live viruses of each disease, and it actually does not cause any of these diseases. So how does the body respond to mumps? Oh, one more thing I forgot to note about prevention. Actually, when you're born before 1957, you are it's harder for you to be susceptible to this disease. So, there's strong evidence of IgG and IgA antibodies in your immune system, and IgA inhibits viral replication. And also, again, with the vaccine, it induces adaptive immune responses so that your body can combat this virus. And there are MUV-specific humoral antibodies in your system, which its main role is to detect the virus in the bloodstream. And even though the virus attacks the T cells in your body, these T cells can become memory T cells, which can lead to lifelong immunity after getting it once. So, you get mumps one time, you're probably not going to get it again because of those memory T cells. So what are the conditions that characterize mumps? Generally, you'll get face pain from the swelling in your face from the parotid gland, headache, sore throat, swelling of your temples, jaws, and glands, testicular lumps in males, central nervous system infection, and later on down the road, if it's very serious, you could get paralysis, seizures, cranial nerve palsies, hydrocephalus, and even deafness. So mumps comes in 3 phases. So the first phase is called the prodromal phase, and it's characterized by nonspecific, often mild symptoms such as like low fevers or light fevers, light headaches, and light swelling. But then you'll get to the early acute phase, which is a little bit more serious, and it's the spread of the virus from your respiratory tract, and your symptoms will start to get worse, and then parotitis will last from about a few days to a week. And then even past that, if it gets worse, it'll be called the established acute phase, which can include a lot of complications, such as orchitis or the swelling of testes in males. You can get meningitis, you can get encephalitis. These could appear as complications alongside the mumps. And symptoms usually resolve itself after 2 weeks, and it'll, heal itself after a course of about 10 days. Long-term complications, as I've talked about earlier, such as the meningitis, is often very rare, and death is often very rare as well. So what's the best way to diagnose mumps and how can it be treated? Diagnosing clinically that you have mumps is an unreliable way to diagnose. So like a physician telling a patient by the swelling of their face, oh, you have mumps, is probably not the best way to go. But obtaining those clinical specimens to get tested in the lab if you're positive for mumps is probably the best way to diagnose someone with this disease. And last, how can mumps be treated? There is no specific cure for mumps. There's no one specific treatment for mumps. It's often a very mild illness, so as recommended by CDC, you should take a 5-day resting period. During this resting period should be very low activity and isolated from people in your home, isolated from other people that this disease could be transmitted to, because again, it is an airborne disease. And additionally, taking acetaminophen could help with a headache, could help with a fever, such as Tylenol, aspirin, Advil, and other medicines as such. And drinking foods, no, I'm sorry, not drinking foods, and eating soft foods and drinking water, staying hydrated will also, quicken the process of healing. And it's also recommended to get acupuncture on the site of swelling of your jaw. This could also help, but otherwise it's just resting and letting the disease run its own course. And these are my references, and thank you so much. Please let me know if you have any questions.